One thing I wish every woman knew about their health is that it's not self-centered or selfish to take time for self-care. We know that if we're stressed or we don't deal with stress or manage stress very well or take time out for ourselves, that can lead to chronic disease, increased risk of that, increased risk of high blood pressure, increased risk of heart disease, and also increased risk of relationship issues, burnout. So it's really important, I think, for all of us to realise that we are allowed to take time out for ourselves, and prevention is better than cure.
You're never too young to start looking after it and investing in it. And to learn about your body, really. I think there's an assumption that we learn about our body at school, which we don't really do, and a lot of that comes often later when you start to have issues, health issues. So I would just like every woman, you know, from a young age to start investing, not obsessively, but start investing in their health, and knowing what works for them.
I think it's really important as women that you know how to advocate for yourself. I think that there are lots of times in the medical system that women get brushed off and said, you know, it's nothing to worry about. So I think it's about being confident that if you think there's something wrong, that you should continue to kind of push and ask for a second opinion to make sure that you get the treatment that you deserve.
I wish every woman knew that her symptoms are valid, that she's probably the biggest expert on her own body, and if something doesn't feel right, it probably isn't. And whether it's pregnancy, puberty, or brain fog or pelvic pain, your symptoms matter, and it's really important that you feel heard.
How to empower yourself and educate from a very young age. So I really believe if we start teaching in schools women's healthcare, menopause, life skills like how to do a breast examination, what's going to happen at your cervical screening, I think that empowers people to have that knowledge, and then there's less scaremongery for people.